Good afternoon and welcome to the FEMA Region 2 Individual and Community Preparedness webinar series. My name is Allison Albright and I am the Regional Preparedness Liaison for FEMA Region 2. I am going to provide a few technical considerations before we begin. Today's proceedings are being recorded and captioned. The archived event will be made available on the Region 2 website in the coming days. You should hear audio through your computer speakers, so please ensure your volume is turned up so you may hear the proceedings accordingly. In the top right corner, we ask if you'd like to receive news from us, and if so, please enter your email address and we'll be sure to add you to the distribution list. We will have a question and answer session after the presentation concludes. You'll see a Q&A pod in the lower right-hand corner. Please feel free to submit your questions about the subject matter there, and time permitting, we'll do our best to answer them. Finally, at the end, the PowerPoint presentation from today will be made available for you to download in the file share pod. You can click on the file and download it using the download button. And with that, I'd like to turn it over to Debbie Costa, the Preparedness Specialist with Region 2, to introduce our speaker and today's proceedings.
Good afternoon, everyone. I'm Debbie Costa, the Preparedness Liaison on the New Jersey FEMA Integration Team. On behalf of our team working to strengthen preparedness across New York, New Jersey, Puerto Rico, and the Virgin Islands, I'm thrilled to welcome you to our monthly Preparedness and Resilience webinar series. As part of FEMA's 2018 to 2022 strategic plan, our goal one is to build a culture of preparedness. Our division is focused on helping people prepare for disasters, which includes helping individuals and families be better prepared and to help build more resilient communities. As part of that goal, we're pleased to be hosting this webinar on grief and loss during COVID-19. Due to the unprecedented COVID-19 pandemic, families across the country are grieving the loss of loved ones. Many are also mourning a loss of normalcy, job loss, and the postponement of major life events. The presentation today will review the stages of grief and strategies on coping with grief. We have two excellent speakers for you today. Our first is Dr. Miguel Marrero, who oversees AmeriCare's Mental Health and Psychosocial Support Services program. In Puerto Rico, he is responsible for designing, implementing, and managing trainings and other supported services for healthcare providers and emergency responders in Hurricane Maria affected communities. He's also been on the front lines of several of AmeriCare's emergency responses, including Hurricane Maria, Hurricane Michael, the Venezuela humanitarian crisis response in Colombia, and most recently, the Puerto Rico earthquake. He earned an advanced studies diploma and a PhD in cognitive psychology with a concentration in emotions and health from the Complutense University of Madrid, Spain. He also holds a master's degree in public health with a concentration in health education and disease prevention from Benedictine University in Chicago. For the past 17 years, he has worked in the fields of mental health, public health, and social sciences. Dr. Marrero had worked for several government agencies in Puerto Rico, such as the Department of Health and the Puerto Rico Mental Health and Anti-Addiction Services Administration during critical times such as the Zika epidemic in 2016 and the Hurricane Maria response in 2017. Dr. Marrero is a recognized public health leader in Puerto Rico and the Caribbean, currently serving as president of the Puerto Rico Public Health Association. Also with us today is John Rouland. He is a psychologist who holds a master's degree in counseling psychology from Naropa University in Colorado, with a concentration in transpersonal wilderness therapy. He currently works for AmeriCare as a member of the Mental Health and Psychosocial Support Team, where he has served responding to emergencies like the Puerto Rico earthquake earlier this year, and now to the COVID-19 pandemic. In addition, John works with Fundación Kinesis, offering personal development workshops in the island's public schools. Mr. Rouland also serves as a member of the board of directors of Foundation Dr. Johnny Rouland. And with that, I will turn it over to Miguel Marrero.
Thank you so much. First of all, thanks for this opportunity. I appreciate to be here sharing with all of you. As you mentioned, the presentation that we're going to be doing today is Grief and Loss amid the COVID-19 crisis. Let's talk a little bit about AmeriCares, just so you to know where we come from. AmeriCares is a health-focused relief and development organization that responds to people affected by poverty or disaster with life-changing medicine, medical supplies, and health programs that have been working around the world during the past 44 years. In Puerto Rico, AmeriCares began after the Zika epidemiological crisis, opening offices by the Hurricane Maria and Hurricane Irma emergencies. As part of our COVID response, we have developed some of these workshops like the one that we're going to be talking today. So let's talk about grief and loss during this process of the COVID-19. Next slide, please. And first of all, let's talk about a hypothetical case. Let's talk about Elena. Miss Elena called our AmeriCare service call center because she reported that her father's death, which took place 2 weeks ago as a result of the COVID-19. Elena reported having feelings and thoughts of guilt for several days and that she didn't do everything in her power to help her father. In addition, she reported that her father was not treated with the best treatment at the hospital and that he was simply allowed to die. She mentioned that her father was a good person and did not deserve God to take him yet. Finally, Elena reported feeling lonely and that she didn't deserve her father to abandon her at this time. So I would like to see if you, the participant, could write in the chat. What do you think? What is happening to Elena? What do you think is happening to Elena? In what stage of grief do you believe Elena is? And as a healthcare provider, what help could you offer to Elena? Let's see if someone could say something to us. Feeling a lot of guilt? Yes, she is. Offer to listen to her story. The guilt stage. Helplessness? Yes. Feeling abandoned? I agree. Denial. She's also angry. Yes, she's really angry. Anger, feeling powerless, survival's guilt, depression, unaccepting of her loss. She's a process of noticing a new situation in her life, frustration, confused, anger. Yes, there are really good comments here. Validate her assets for safety. So yes, she's experiencing emotions associated with grief in response to the loss of her father. Such emotions include self-guilt, as many of you have said, guilt of harming others, helplessness, resistance to change. Elena is in this second, we're going to be talking about this later, second stage of grief known as anger stage. In this stage, there is anger or courage relating to the loss and anything associated with that loss. Among the different ways in which help can be offered to Elena or any patient who is processing the grief and loss, guidance and support are primary. We can help the individual in understanding that the grieving process is only natural in the wake of losing a loved one, and that it involves stages in which feeling and emotions can be affected. In addition, guidance can be offered on the stages of grief so that they may know what to expect in each of them. Finally, mental health and emotional support service can be made available to the person for them to overcome their loss. And next slide, please. Thank you to to all of you for all of your comments. They were really good. So at the end of the presentation, we're going to define grief and its process, including the different types of grief. Know the factors that influence the grieving process, including personal, social, and developmental factors. Also, we're going to be able to identify the stages of grief and its applicability to the COVID-19 pandemic. and know the recommendation for positively coping with completing the grieving process. Next one, please. At the end, we also want to understand what need do you have as a health professional with regard to grief during an emergency, and what help can you provide to your patients, participants, clients with regard to grief during an emergency. Next, please. So I think that we should begin by defining what is grief. And grief could be defined as a natural reaction to the loss of a person, object, some significant event, or some abstraction that has taken its place, such as the homeland, freedom, and an ideal, among others. Among the different processes of grief, the most painful is that of confronting the fragility of life itself and that of our loved ones. The intensity of mourning depends not on the nature of the lost object, but on the value attributed to it. And completion of the state is essential when considering the duration of the grieving process. So it is going to include emotional behavioral reactions in the form of suffering and distress when an affected bond is broken, and it also includes psychological, physical, and social components with an intensity and duration proportional to the size and the meaning of the loss. Next one, please. There are different factors influencing the course of grief: individual personality, history regarding death and loss, age of the deceased person, nature of the relation with the deceased, personal background of the deceased, social support, like for example, family, friends, professionals, characteristics of the dead person, like for example, the sex, the health status. So individual personality will refer to the personality of the person grieving, ability to contain or express feeling and emotions in order to establish effective bonds. Circumstances of death or loss reacting to an unexpected, sudden, or traumatic death, such as a homicide or suicide or an accident, is not the same with reacting to an expected death. When we talk about the age of the deceased, we should understand that grief is more intense in the death is premature, like for example in child, adolescent, young adult, or elderly. When we talk about nature of the relationship with the deceased, level of attachment to the deceased and loved one is what we refer. And when we talk about the personal background, we talk about previous griefs and the development of this, predisposed childhood experience and or insufficient psychological development. Next one, please. Children tend to have less understanding around the traumatic event and face limitations in communicating what they feel. Some children completely deny or are indifferent when they learn that they have lost one or more of their relatives. The emotional impact is so severe that they don't talk about what they have been through. Some adults may assume that the child has forgotten, but it is not true. They are able to remember and to recount the traumatic experience when their feelings or fears are under control. Next slide, please. When we talk about the elderly and their vulnerability, in some communities, the elderly are an acknowledged source of experience and wisdom as they serve as historical memoir for how critical situations have been faced over time. However, some may be at risk of being in vulnerable situations as a result of chronic disabling disease, being isolated, and lacking family and social support network. So now I'm going to let you with the psychologist Johnny Ruyan. Johnny.
Thank you very much, Miguel. So we're now going to go into talking about different types of grief. It's important to know that not everyone experiences grief in the same way, as we will see, and even within like types of grief, there are many different phases, as we're going to explore later on. And this helps to recognize certain characteristics that may be presented by people who have lost either a family member or a loved one, especially during these challenging times. In addition, knowing these different types of grief can help healthcare providers and first responders to locate that person who is being provided with some support or service as a result of the loss of a family member or a loved one. So it can help identify. So let's begin quickly talking about the main types of grief. We can begin speaking about maybe the more concerning type, which is the pathological or complicated grief. And in this type of grief, we see an intensification of the symptoms of grief to a degree in which the person is overwhelmed, resorts to maladaptive behaviors, or remains in this state without advancing or progressing towards any resolve. So some signs of this type of grief can be, for instance, pain, which is prolonged over time, very acute pain that is far more prolonged than is usually seen. Its intensity does not match the personality that we're accustomed to seeing prior to the death. In addition, this type of grief can prevent loving other people or taking an interest in people during this process. And overall, then the person going through this type of grief becomes basically non-functional in their daily life as they're very much occupied by the remembrance of the deceased and of the loss. So now we can go look into another type of grief we can call anticipated. This type of grief does not begin at the time of the death, but rather long before, usually when a diagnosis is issued with severe prognosis. So it's kind of an anticipation type of grief. Then we also can see pre-grief, which is a complete grieving process in and of itself, which also happens prior to any actual death, and which in this case consists of beliefs that the loved one has died already due to their health complications. So pre-grief has to do with actually experiencing a perceived death, as if the individual, the person who was sick, actually dying before that takes place. And then we have chronic grief, which has an excessive duration and never fully reaches a satisfactory conclusion. Chronic bereavement can take up to an entire lifetime. And then we have the non-complicated grief, which is the ideal, the healthy form of grief that we can aspire to. And this is, as I mentioned, this is the object of clinical care. We want to help people arrive to this non-complicated. So what does it look like? A normal reaction or a desirable reaction during the grief process is where, we see characteristic symptoms of an episode of major depression that is actually part of a normal response. So feelings of sadness and other associated symptoms such as insomnia, lack of appetite, and weight loss can all be part of an actually healthy, normal grieving process. The grieving individual often considers their depressed mood to be normal, even if they seek professional help to relieve other associated symptoms which they experience. So now that we've seen the major types of grief, let's go into the stages of grief. And this is all based on what has been developed by Kubler-Ross, a very popular model, and we'll be reviewing those stages and seeing how they apply to our current reality. So the first thing you'll notice is that we have the 5 stages, but there are bidirectional arrows in between each stage. And this is because this is not to be deemed as a linear process, but rather as one that is more fluid, in which you can jump from one stage to another, not necessarily in a sequential, linear manner. So you could return to an earlier stage. You could have various situations, circumstances inherent to the process of grief and loss happening simultaneously even. So let's look deeper into each stage. And we'll begin with shock or denial. And the main question in this stage is it true? Is it possible that this could have happened? Why? Or why me? Or why now? And this is a very difficult stage, and the loss is not deemed as being real. And this first stage actually helps us survive the loss, as it helps us protect us from the pain, which at that time might be or is unmanageable. And it helps us take it in manageable doses. So it's almost like blocking the sun with your hand, but it helps to not get the full brunt of the pain all at once. And during this extraordinary situation of confinement and not being able to see the person who has left can definitely sharpen the intensity of this stage. We can define this stage as the feeling of disbelief, as I mentioned in the beginning. We don't believe what's going on, we don't believe what could happen or what can happen, and we refuse to believe what's going on because it's just too strong to be true. And if you add to that the layer that we cannot bid a proper farewell or do a proper ceremony with our loved ones, as I mentioned, the stage can become more sharp. The pain can be even greater, therefore the need to maybe block some of it out and deny it. So our ability to cope with this loss is questioned. It can lead to a degree of insensitivity, and we may even be paralyzed. We can be paralyzed as far as functionality or the fluidity of emotions, etc. So let's go on to the next stage, which is anger. Highly emotional process which manifests itself in many different ways. The person may feel that he or she needs to direct his or her anger toward what surrounds him or her, or the person themselves through destructive behaviors. And we can see this manifest in many different ways. The confinement and the current distance that we are all obligated to adhere to can definitely increase the intensity of anger, and we can see more of a bottling up effect, which can spill out in bouts of anger. So when the person connects to the loss they have suffered, they may feel angry and have these types of questions. Why did this happen to me? Why couldn't I stay with you? How could she be alone? I didn't protect them enough. Okay, so just kind of throwing those questions out there, so maybe that can help as we work with clients or patients, kind of pick up those signs to better, get the lay of the land and understand what part of grief someone might be in. So those are some of the questions or dilemmas you might hear. So where is this anger directed, right? There are several destinations for this anger in the mind of the grieving person. They can be against the causes of the change or loss. They can be against the lack of care for the person, anger against not providing the necessary care to the person. Maybe it's anger towards oneself and feeling like I didn't do enough. Anger for not recognizing that the loss was going to happen. Anger because I didn't avoid it. Anger against the medical personnel who did not take the necessary measures to prevent the loss. We're talking about perceptions here, not that that necessarily is true or any of this. Even anger against the deceased themselves because they have abandoned us, or anger against a superior being, God, or a figure of faith for allowing this to happen. Okay, so there's a brief introduction to that stage, and let's go on to the third stage, bargaining or negotiation, right? And this is an attempt at control, a basic need that we humans have. So in this stage, we face the blame that has been created, and there is a reconciliation with those to whom anger was directed, whether it be myself, the deceased, the medical personnel, God. There's an attempt at reconciling and negotiating our way through this. Now, they're not perceived as guilty, right? Guilt fades and gives way to commitment, to the pursuit of goals focused on personal development. I want to donate money for research. From now on, I will support health more. I want to be a volunteer. And by the end of the stage, the person begins to slowly accept the tragic reality that he has lost, or he or she has lost their loved one. Okay? And this is all an attempt to try to get life and back to the way it was, and for the loved one to be restored. So there isn't a full acceptance yet, but we start to seed and try to work through a different strategy, in this case, bargaining. And now we'll look at depression, and this is where we'll see emotions, obviously sadness, a sense of emptiness and a void, and intense pain, coupled with thoughts that connect them to the loss. For example, I don't know if I can live without such and such person, such and such idea, place. You know, as Miguel mentioned, this isn't necessarily always related to a person. It can be a lifestyle. You know, maybe we all went through some sort of grief going into social isolation and social distancing. We had to give up a way of life. So, you know, we could even see grief in that sense. So in this stage of depression, the person may return to their daily activities. However, they look empty and they're useless. They might feel empty, useless. People around them may notice that lethargy, and others may want to help in this process. And it can be quite evident that someone is in this stage of depression. Someone who's going through this stage has their attention much more redirected towards the present. The feelings of emptiness and sadness appear, and the grief basically deepens. We go into a deeper level of the grief and start to tap into the raw pain which comes with it. And in this process, even the meaning of life can be questioned. Why do I have to move on? This is unbearable. This has no purpose. These are the types of questions that we can see. And very important for all of us to know when working with clients and patients, when we allow ourselves to experience these feelings associated with sadness, depression, loss, grief, it actually allows it to naturally disappear. And in my master's, I loved this kind of aphorism that we learned. I'm sure some of you might have heard it. You know, what we resist persists. So if I allow it and I read it with acceptance, it actually helps it kind of go along its way and be processed and be, you know, and disappear. But if we resist it, it might build up more force. So very important to always allow for oneself, and obviously in our relationships with clients and patients, to allow them to have their experience, to feel their emotions, and to be validated in them. And all that will help us ultimately arrive to the fifth and desired stage, which is acceptance, or rather the ultimate stage of acceptance, where the loss and the pain are both recognized as well as the repercussions that they entail, without having to seek any culprits or taking a position of defeat. It is the new reality by which a person must live, refit themselves, and through which they can finalize healing, even if it seems unattainable. The objective reasons for the loss are accepted, even if they are not understood. Okay? So in this case, the physical absence of somebody is truly accepted. The permanence of that absence is acknowledged and accepted. And this is to not to be confused with the notion that a person feels good or that they agree with what happened. Those words do not equate acceptance. We can accept something while still feeling miserable. We can accept something while being in complete disagreement with it happening. And, you know, this acceptance is made evident through actions of remembering, reorganizing, and regaining composure. So those are the 5 stages outlined by Kubler-Ross, and with a little bit of an adaptation to our current reality in the pandemic. And now we want to quickly go over the main emotions that we've covered a few of them during those stages, but we want to go more specifically into the emotions themselves that are related to the grieving process. As a healthcare provider and first responder for an emergency, it is important to recognize these emotions in order to offer appropriate aid in managing them, right? We're living quite an extraordinary situation, and we have no previous references to compare with. Therefore, we might see unprecedented emotions or unprecedented intensity of emotions that can arise in our practice caring for others. So it is important to always allow the survivor and their family members to feel whatever emotions emerge, as I mentioned, so that they can properly be addressed. So let's go into fear. Okay, this has been experienced from the beginning of the health crisis, and a loss of a loved one only sharpens these sensations of fear evermore. After the news of a loss, what were initially signs of alert and simply possibility have since then become a crude reality. Along with fear, we can experience stiffness in the body, sensations of choking or dizziness, restlessness, and even mental blockage. Research suggests that 80% of people in circumstances of proximity to disease and or death demonstrate varied manifestations of fear and panic, which can be accompanied by these physical symptoms. And now we'll look at anger, which we touched on a little bit earlier. Along with that anger, we can see kind of this subset of emotions or experiences such as impotence, feeling that you couldn't do anything to prevent the outcome. And this obviously is a very, very frustrating acknowledgement or belief, right? And so with that frustration, we can also see because circumstances limited you to doing things as you would have liked. Obviously during this pandemic, as I mentioned earlier, we cannot go about the process of caretaking for an ill, a loved one who is ill, for bidding farewell, or for doing the appropriate funeral ceremonies with loved ones. And all this can bring even more frustration because we could not carry out those typical key pieces in saying goodbye to a loved one. And this can all feel very unjust, can feel a strong sense of injustice, and this can all breed much anger. So it's important to understand that given the circumstances, a lot of these emotions can be presenting in a way that we're not accustomed to, longer duration, higher intensity, etc. And we'll speak about sadness. Each of us experiences sadness differently. Some cry, and even one person can have different stages and go through different ways of manifesting it. So we see crying, seeking loneliness. In other cases, we seek a lot of social support and comfort, or maybe just needing to feel our own heat, right? Sadness is the expression of pain in the face of a significant loss. It can even be seen as a way to pay tribute to someone who loved you, and vice versa. And I think this is very important. We all, any person has their own particular way of signifying what sadness means for them. And we see this across cultures. Even within the United States, you'll see different subcultures among states, and obviously in different countries. But sadness, a feeling so common and worldwide as sadness, and any of the ones that we've been mentioning, can all be signified differently depending on your cultural reference. So obviously just important to always be open to validating and offering support and comfort in the way that person needs it, considering their background, and always being curious as to how do they interpret sadness. And it might even be a way of honoring the deceased. So maybe we don't need to yank them out of the dark hole or rescue them, but actually just kind of sit with them and allow them to be where they are. And guilt. This emotion can appear in statements such as, why didn't I bring him home? How can I not take care of him anymore? I should have gone to check that he was fine. Right? This can be a lot of self-sabotaging beliefs, statements in which the person blames themselves for what has happened. Ultimately, are attempts to believe that they may have prevented the loss, that they may have prevented the death, and therefore we can see that these are attempts to feel that they have control in the situation. So those are the main emotions that are going to be manifesting during a bereavement or a grieving process. Now, what can we do? What can we do to work with the families of patients enduring grief and the pain that comes with it? Survivors typically have a range of doubts related to, how do I manage the losses? How do I go on with my life in the wake of this new reality? How do I say goodbye to the deceased family member? And these are all things that we can help not only the client, the patient themselves, but also their family members. It is important to be aware of these recommendations so that families may be guided in the different alternatives that they have in order to overcome their loss and manage grief, especially during these times in which it is obviously much more difficult. It is important to recognize that we will not impose any recommendation over another. Rather, we will always allow the individual to choose the way in which they want to deal with their process themselves. So, what to do and what not to do when overcoming pain and grief. Let's begin with farewell rituals. Yay or nay? Well, this is without a doubt an exceptional situation that we're living. And consider that further ahead. If you need it, you can still perform the ceremony or ritual that you would have liked to perform during this time, or some other alternatives. So it's really just a matter of deferring it for a while. And that this is a good framework to be able to offer to clients and patients, that it's not a matter of not doing the rituals, it's just a matter of postponing it. But of course this is important. Of course this is crucial for closure for everybody involved. And let's plan a good farewell ritual down the line when we can do it correctly. So, the second consideration is, do I validate or do I suppress emotions? Oh, sorry, excuse me. Yeah, I'm going to have to jump back a slide after this. So, validate or suppress emotions. Validate, validate, validate. Validate your feelings. Your grief will bring you emotions that will be difficult for you to live with. You can't choose how you feel about the loss, but you can choose how you react to what's emerging naturally. Remember that what you feel or don't feel are normal reactions of your body and mind doing their best to digest their pain. It all kind of comes from this innate intelligence to actually help you overcome the pain. As we saw with the first stage of denial, kind of helping us take the pain in doses. Well, everything that we're experiencing, including those tough emotions, we saw it with depression. We need to actually touch base and actually feel that raw emotions once we're ready to, are all very important steps to actually fully going through and completing the process. So validate, 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 no need to suppress. So I'm going to go back to this slide where we have some more what to do and what not to do. And the first one is, do I face bereavement alone or accompanied? And definitely in whatever measure possible, we should look for that support where we need it, but also at the same time to be able to to give yourself your own space and to set boundaries if you prefer to have time alone, or as you mentioned earlier, just feel my own heat. So really, it's whatever you need in the moment. There's no, it's not black or white. The next consideration is think or not to think. Well, we would like to say think, but only to the degree in which you are capable of doing so. And we're referring to thinking about the loss, thinking about the person. Take a break from thinking when you feel you need to, because the physical absence of a deceased person is something you'll think about your entire life. When your mind and body asks you questions, bring you images or memories, don't close the door. That would be very unproductive and even more painful in the long run. So it's good to think, it's good to allow all these images and thoughts to arise, but just try to, keep a monitor of how much I'm capable of doing. And if you feel like you're reaching your threshold, it's okay to do some form, even a ritual, maybe taking a walk, washing your hands, taking a shower, kind of doing a fresh restart, to just kind of clear the way and change the channels. That is also okay. It's part of self-care. Third consideration, keep quiet or talk about the loss. We recommend talking about the loss when you need to. Talk about how you've undergone and are enduring the loss so far. It's good to talk to whomever you need to, however much you need to, and however you need to, within the possibilities of social distancing. Never should one force a grieving individual to talk, however. Never force them to talk about what they don't want to talk about, or force them to silence whatever they need to speak. So it's important to follow the lead of the person undergoing the grieving process. If they want to talk, we're all ears. If you want to be silent, we respect your silence. This is ever more the case during the current circumstances. After a while, when you have already expressed your pain and you have shared your feelings, fears, and memories, try to resume other topics of conversation. Reconnect with your day-to-day, with everyday topics. Maybe talk about that Netflix series or this kind of social topic. Talk about your dreams and motivations. Although they may seem superficial and not interesting to you at the time, speaking of them may make your discomfort more bearable. Okay, so that's also good for us to know as health providers working with clients who might be in these situations. We don't need to be talking about the depths of grief at all time. We can also talk about more menial, mundane, cultural topics. Okay, so let's talk about the impact on mental health and some positive coping that we can do to manage the grieving process. Check how I'm doing on time real quick. Okay. So I'm going to cover this quite quickly. So the next few slides, we'll be talking about the impact of COVID-19 on mental health and some alternative coping mechanisms that we can use. So a major epidemic involves psychosocial disturbances that may exceed the management capacity of the affected population. The entire population may be considered to be suffering tensions and distress in one way or another. Okay, so on a level, on a macro scale, our whole population is undergoing, mild, severe impacts to mental health, and this can sometimes, we as healthcare providers are the ones that might carry a lot of the burden of this because they might exceed the capacity that we have to attend everybody reasonably. So considering this, what are some recommendations for health service personnel and responders in the emergency to be able to do our part in helping however we can? So firstly, it's important to find a way to make it easier for the patient to leave peacefully and accompanied in one way or another. So after we have any encounter with a patient or client, that they can leave whatever contact that we had with them in a manner that is peaceful, and that they're make sure that they have some kind of company. You know, these are some of the, you know, at least we can do this with whoever we come into contact with, right? We can help family members express their feelings towards one another, and especially if the case involves expressing feelings towards a family member who is in the final days of their lives, to actually help facilitate that closure or that farewell. And now we'll talk about when a patient is convalescing or recuperating. As we call family members, so we're talking about direct contact with family members of a client or a patient who is undergoing grief, or I know we have a different section where we'll be talking about informing of a death, but here we are talking about convalescing, pardon me. So the first thing that we're going to do is identify ourselves. And we're going to give clear and progressive information. Find a moment in which we can spend a few moments on the phone. Do it from a place where there's not a lot of noise, and we can offer the information as calmly as possible. We give the option to ask and answer questions. And if we don't have the information, we simply communicate that. We communicate exactly that. I'm sorry, I do not have this information available at the time. I can link you to somebody who can answer your questions, or I'll try to answer this and get back to you. But it's very important to not make up any information or improvise, rather to be very clear about that. So let's move on to a little bit more. We're going to inform them of the concern and attentiveness of their relatives. We're going to offer the possibility to convey a message to their family members and facilitate it with the resources that one might have. Offer the option to ask and express what he or she needs, and ultimately to serve as a mediator between the patient and the family if needed. This can be extremely helpful in time like this. Obviously, not everyone has the same access to, smartphones and 4G and LTE and, all the, I don't know if I said those correctly, but, it's all the connections and hardware to maintain human relationships and communication during these times. And sometimes that we might be the only bridge, or at least for some forms of communication. So it's important that we be willing to serve as that connection and facilitator for communication, especially in these times where a family member might be lost. Okay, so here's the part that I was referring to earlier. When the patient passes away. In this tragic situation, it can be our responsibility as healthcare providers to inform the family members of the patient of the passing. So when we make this call, obviously it's important for us to be calm, cool, and collected, to find a good space for ourselves to make this call. And we're going to notify the family by phone. We're going to make that call, provide psychological company to family members who need it, inform the family member that it is not possible to make physical contact with the deceased, send a letter of condolence and/or make a subsequent call, a follow-up. We will offer emotional support to other patients who may have been accompanying the deceased. And if you consider it and need it, perform a small parting act with your patient. And again, the weight might, the responsibility might be on us, because if we don't mediate this kind of closure ceremony, it might not happen until months later or at all. And in the grieving process, it is very important to have these types of rituals or ceremonies to actually feel and undergo closure and to have a sense of closure. So we might be in that role of helping facilitate a small parting act with the patient if need be. And now let's go into some alternatives for coping with the general stress, burnout, compassion fatigue, and grief. Because obviously everything we've spoken about up to this point, it can be very taxing on us as healthcare professionals. Empathy, if it can be an open door through which we can take on clients' and patients' emotions and experience burnout, compassion fatigue, etc. So what are some physical reactions that we might see when we're exposed to this type of work? On the physical level, nausea, fatigue, chills, dizziness, headache, tachycardia. This is all normal. Emotional level, anxiety, fear, irritability, and even emotional shock. On the cognitive level, hypervigilance, intrusive thoughts, and confusion. And on a behavioral level, inability to rest, inability to eat, or compulsive intake, accelerated speech, and even screams. Okay? So these are all normal reactions to when we've gone over our limit, right? And we're experiencing burnout, we're experiencing compassion fatigue, prolonged stress, and even grief. So it's important to note these signs and to be able to say, okay, I need to take care of number one, myself, so that I can be of service to others. So what are some ways in which we can do that? Well, positive coping for providers. First and foremost, meet with the team. You have people that are in the same boat as you who can understand your struggle, and it's very useful to have meetings to debrief, diffuse, and people can vent and talk about their experiences and learn from each other and support each other. Lean on your colleagues and obviously your friends and your family. You can practice meditation. Try to practice at the beginning and end of the day. Start the day with a positive and optimistic internal and external discourse. Cultivate compassion, kind and understanding attitude towards yourself and others. And hopefully this information can help you have that kind and understanding attitude and to know that what you're experiencing is normal. All these, the desire to be a Superman or a Superwoman can sometimes take hold of us, but it's important to recognize that we are human as well, and we need to be taken care of as well, and we need to be there for ourselves and know when to take a pause, know when to lean on another. Some more strategies can include finding comfort others, comfort yourself, allow yourself moments to connect with the pain and stop to allow the emotional overflow to flow. Cry if you need to cry, yell if you need to yell, take a nap if you need to take a nap, within the right parameters. Take advantage of the mental health professionals who are available to you. This should not be a stigma. Those who look for help, that is a strength that they have. To look for help is a strength. Take care of others and take care of yourself. Eat healthy. Try to get enough rest. This might require some discipline. Unglue the screens of our phones from our face and turn off the light. Do some sport, exercise, get those endorphins flowing, disconnect from news and work, all in time slots. Humor, to its right extent, can be a good strategy for releasing emotions and tension. When a patient or a known person dies, you can use the recommendations that have been offered to the family. So everything that we have mentioned as far as strategies for oneself, that same list we can use to help family members after experiencing a loss. And our last, so those are the coping strategies. And thank you so much for your attention. I'm going to pass it back to our moderators, and hopefully you all have some questions for us, and hopefully we can help. Thank you.
Thank you both so much. That was a lot of very important information. We do have a few questions for you. Aaron made a comment. He said that he was wondering if the stages of grief is less important than talking about the dynamics of grief. It seems like stages suggest that there is a linear trajectory of grief instead of it being a knot of grief dynamic. So if you want to comment on that at all, John?
Yes, I completely agree. This is Miguel. Thank you for that question and that comment, and I completely agree. You know, and as Johnny mentioned, the stages are fluid and are not linear. Each person's experience of loss and each response is unique and different. So yes, we agree that we are talking of a dynamic process, and you could go back and forth from the different stages. I don't know if Johnny want to mention something about that.
Did you want to add anything, John?
Sorry, yeah, I just unmuted my phone. No, I agree completely with what Miguel said. You know, it isn't necessarily a linear process, but I think, you know, given that model, every one of those will be experienced before arriving to full acceptance. And I just want to emphasize that it's very important to acknowledge what kind of emotion or stage a client or patient might be in, and to just offer full support and validation and permission to feel that emotion, to express that emotion, because that's what's going to allow them to actually move on to whatever next stage might be, and ultimately to acceptance.
Thank you. Could shock or denial become compounded by the fears brought on by COVID-19?
Absolutely, and that's exactly what we had mentioned in that first slide of denial, that it can be very much sharpened and intensified. Why? Because that is a response to protect us from the load of pain which is oncoming. And the circumstances that we're going through right now of not being able to have much contact with someone who is ill before they part, without being able to say goodbye, without being able to really undergo those closure and funeral ceremonies, all of this can bring a higher dose of pain, therefore increase our kind of internal coping mechanisms of blocking out pain, of dissociating, of being in denial. So yes, very big yes to that question.
In the case of a long-term illness prior to death, have you experienced individuals navigating some of the grief process before the actual death occurs?
Yes, absolutely, and that is what we referred to in an earlier slide as one of the main types of grief. We have the anticipated grief, and then there's the pre-grief. In the pre-grief, the individual actually experiences as if the person had died, when in fact they haven't died yet. And the person goes through an entire grief process when that person has not actually passed away. And then in the anticipated grief, we see a process of grief happening as well, just an anticipation. So there's not a belief that the person has passed away, but there is an entire grief process that happens before the death in total anticipation. So yes.
I totally agree with that.
Another person wrote, I wonder about grief work and the long-term potential impacts on our healthcare workers and funeral director staff who have borne a greater share of the public burden of this pandemic. That's something you would want to comment on?
I think that the different professions and different areas working in different areas with are being affected, maybe in different forms, but are being affected. Usually, we think that the people who is dealing with these kind of situations all the time are going to be better or have some better coping mechanisms. But we are dealing with a very different situation here with the COVID. It's a new situation where the people, the families, the community doesn't have the opportunity, as Johnny mentioned before, to say goodbye to their people. And that's what those working in the funeral homes are dealing with day after day. So that affects them. Of course, that affects. And we should include that when we design programs to support our communities and also the different type of responders. I don't know if Johnny wants to jump in here.
No, excellent response.
I'm sorry. I was going to say the next question actually builds directly off of that. They're asking for suggestions for individuals who are emergency managers and dealing with this, every day, better ways, I guess, for them to cope, different coping mechanisms.
Yes, and that is a really interesting point of view, because they live, they are in this dual role, because they are living the emergency as a citizen, as a person living in the process of the pandemic, but also in their work with this secondary trauma, So there are different things that we should do. First of all, to know, to understand, to look at, that acquisition of information and coping skill, the development of those coping skills. Another thing is the recognition, or to identify risk and exposure that we have in our different jobs related to the emergency. And third, I think it's to respond, it's the application of skill. And that included, for example, like self-care, the peer support, activities like the ones that Johnny mentioned before, like the debrief and the diffuse process between the partners and the peers. Those things are very important, especially the self-care and taking time and looking for help, also looking for help if you need it.
Thank you. I think that's all we have time for today as far as questions go. We do have this exact same webinar being hosted tomorrow in Spanish. The link for registration is on your screen. There's some other upcoming webinars that you see there: stress management, hurricane preparedness, webinars. A lot of times we're offering them both in English and Spanish, so you could click on any of those links on your screen. We have how to avoid disaster fraud coming up in English and Spanish, information from HHS on Medicare and Medicaid waivers in English and Spanish. We're working with GSA and MTA and New Jersey Transit on getting back to work. So those who have to take public transportation to go back to work. So that webinar will be coming up at the end of the month. One that I'm really looking forward to is who are the people in your neighborhood, community asset mapping. So looking to see what you already have to help assist with recovery. And then we're going to be talking about vulnerable populations and English as a second language, how the FEMA programs work for that community. So I thank you. I thank our speakers for a very informative presentation, and I thank everybody for joining us today. And I hope to see you all in our chat room again soon. Have a great afternoon, everyone. Be well.